Many women come to our clinic complaining about huge breast size. Now, huge breasts is not only a socially embarrassing problem but also cause pain in their neck and shoulders. So these women come that they're socially embarrassed and they have droopy shoulders and they have neck pain, shoulder pain, and they say, "Doc, we want to reduce the size of the breast." So today we will talk about how one should prepare for a breast reduction surgery. Whenever you consult a plastic surgeon, make sure that you discuss in depth about the new shape of the breast and the size of the new breast. Because one should aim to do the surgery once and do it properly. So in this video, I'll be explaining you about what I discuss with my patients about breast reduction surgery before we prepare to take them for actual surgery. First and foremost, we need to understand what is their present size and what size they want breast to be reduced to. Suppose if they are cup size D or E, what is their expectation, whether they want to go for A or B? This needs to be very clearly defined and noted down on a piece of paper so that the patient knows what they want, the doctor knows what they want, and the surgery can be done absolutely precisely. This we talked about the cup size. The other measurement when you go for and buy a bra is the numerical value or the band size, what we normally call as 32, 34, 36, 38 and so on. That needs to be discussed as well because that needs to be reduced. Suppose you are 40, what is your desired size, 34, 36, and whether that can be achieved or not, that also needs to be discussed with the doctor, and that has to be also noted down. So what we have discussed till now, the breast band size as well as the cup size, both needs to be defined and directed and noted down so that the patient expectations and what a doctor can deliver is realistic and absolutely clear. The third thing what we need to discuss is about the shape. And a lot of women, when they have a sagging huge breast, they do not have an upper pole fullness as well as cleavage. Now my aim is not to just reduce the size of the breast, but to reshape the breast in such a manner that it looks very aesthetic, so that we make sure that upper pole fullness is achieved. We also make sure that the cleavage is defined so that they look nice even if they wear dresses or even if they wear normal Indian clothes or maybe tops. It should suit them whatever they wear. So the cleavage lines as well as the upper pole fullness is discussed. This is the third and the fourth thing which needs to be discussed with the doctor. And then we discuss about the recovery process. Usually which I do is a daycare procedure for breast reduction surgery, and patient goes back home the same day. They don't have much pain, they can walk and talk and do all their activities from next day morning. So it's a very comfortable process, but please discuss this with your doctor as well. And the sixth point which needs to be discussed is about the scars. What I prefer is a short vertical scar technique so that the scar which is there on front of the breast, it's a vertical scar, but it fades nicely over the next 7 to 8 months. The circle part of the scar is at the junction of a dark skin and a light skin, which is also called as a periareolar scar. That is usually not visible and not much of a concern. I usually do not do an anchor technique in which there are horizontal big scars, but do discuss this with your doctor as well. So, to summarize, before you plan for a breast reduction surgery, you should prepare yourself with what are the kind of sizes you want to reduce, the cup size, the band size. You need to discuss about your recovery process. You need to discuss about the upper pole fullness and the cleavage and the overall shape of the breast, about the breast aesthetics. And the sixth thing you need to discuss and know about is the scars which you are going to get. The information which you are going to get will help you calm down, will help you prepare yourself in a much better way for surgery so that you have a great result, something which you have always been wanting. If you have more questions about breast reduction surgery, do write into us and I'll be there to personally help you. Take care, bye-bye, all the best in your cosmetic surgery journey.